Welcome to Addiction Group's podcast, where we address pressing questions about addiction. Our goal is to provide insight and guidance for those seeking answers. I'm your host, Anna. Welcome to Addiction Group's podcast. Today we're going to discuss an important and unfortunately widespread issue, alcohol use disorder, or AUD. I'm thrilled to welcome our special guest, Ben. Ben is an expert in addiction and recovery and will offer us some enlightening insights on this matter. Welcome, Ben.
Thank you, Anna. It's an honor to be here and talk about a topic that is often misunderstood or misrepresented.
Ben, could you explain to us a little about what alcohol use disorder is?
Definitely. Alcohol use disorder is essentially a result of an uncontrollable desire to consume alcohol, often prioritizing it over obligations and responsibilities such as work and family life. This tends to be a gradual process. It doesn't just happen overnight, but as part of a larger pattern of misuse of alcohol.
Are there some common warning signs that someone might be struggling with AUD?
Yes, there are. They may consume alcohol more often or for longer than planned, experience anxiety or depression when not drinking, or frequently be hungover. Interactions with family or work responsibilities may suffer. In essence, anyone who continues to drink despite negative consequences is likely dealing with AUD.
Okay, so if someone knows a loved one is struggling with AUD, what's the first step they should take?
The key is understanding. Understand what alcoholism is, talk about the drinking problem with the person, and then explore options for addiction treatment with as much support as you can offer.
So how does one understand how alcoholism affects the person they care about?
It's important to know that this struggle isn't due to a lack of willpower or moral weakness. Alcoholism is a complex disease that can result from a mix of genetic, environmental, and social factors, and it can literally change the brain, which in turn influences their ability to make healthy decisions and resist the urge to drink.
Now let's talk about interventions. How can loved ones provide helpful interventions?
The most effective interventions involve people. The affected person trusts and respects, offer a sense of hope and support, and are overseen by experts in the field. It's also important to approach the person when they're sober and emotionally stable. Use calm and respectful language, and importantly, ensure they do not feel attacked.
Let's move on to treatment and support options. What should loved ones know about these?
While it's crucial to discuss treatment, remember that they must decide to pursue it themselves. It's key to research these options and presenting them at an opportune time. But don't let their needs overtake your own. Codependency is dangerous and can be avoided by maintaining personal boundaries.
What if the person is in denial about their problem?
Denial and anger are common responses and should not be taken personally. Give them time and space to process things. When they're ready to discuss it, introduce them to a local support group. This can help them better understand their condition.
Could you briefly tell us about the various treatment options available for someone struggling with AUD?
Sure. Options vary based on the individual's level of dependency. Detoxification can often be the first step, helped by medication to manage withdrawal symptoms. Then there's medication-assisted treatment, MAT, which uses various drugs to prevent relapses. Joining peer support groups like Alcoholics Anonymous can also be helpful. For severe cases, inpatient residential detox and rehab programs can be effective.
And finally, Ben, what should someone expect once their loved one enters rehab for alcoholism, and what benefits and success rates can they anticipate?
In rehab, a multidisciplinary team will assess and monitor the patient's health and create a personalized care plan. This process often includes education, counseling, and therapy sessions. Research indicates that individuals who receive treatment for at least 90 days have significantly improved outcomes. Also, support from loved ones plays an important role in enhancing the success rate of the treatment.
This has been incredibly informative, Ben. I think our listeners, too, would have gained a better understanding of this significant issue and what they can do to help their loved ones. Thank you for your time and expertise.
My pleasure, Anna. It is so important to continue conversations like this to boost understanding and reduce the stigma associated with alcohol use disorder.
Thank you for tuning into Addiction Group's podcast. We hope our discussions bring clarity to your queries about addiction. Remember, we're here to support and guide you. Until next time, stay informed and stay strong.